Warm greetings to all of you and welcome to this web conference dedicated to the use of digital technologies in the fight against COVID-19. I'm Lambert Montevecchi, founder and CEO of Boost Consulting. We are a change management consulting firm entirely dedicated to the healthcare sector. I would like to introduce you to our guest speaker from France, Marjolaine Collet-Vételé. Marjolaine is currently in charge of partnerships for Normand E-Santé, a public digital health service which promotes e-health projects and telemedicine. For 12 years prior to holding this position, Marjolaine was the director for the Regional Union of Liberal Doctors in Normandy, in charge of implementing digital projects. Her knowledge and experience in the implementation of e-health projects makes her an ideal person to interview as part of our conference. Dear Marjolaine, perhaps we could start by asking you a very basic question. Can you give us a general overview of the current situation in France regarding the COVID-19 pandemic?
Thank you, Lambert, for inviting me. So, France counts 18 regions. I work for Normand E-Santé, or NES, regional GRADS. There is a GRADS, which means Public Regional Digital Health Service Company, in each region. Our mission is to upgrade hospital information system and deploy telemedicine amongst regional healthcare professionals, as well as other communication solutions for healthcare professionals. NES works with other public regional digital health companies in a collaborative way, and this enables reciprocal progress between regions. On April 30th, Normandy, 3 million citizens, counts 283 deaths, median age 81, 663 hospital patients, including 143 in ICU. In France, we have 20,265 deaths, 30,484 hospital patients, including 5,683 hospitalized in ICU. Before COVID-19, in Normandy, we only had 240 ICU beds and now 485. At the beginning of the containment on March 17th, we counted only 5,000 ICU beds in France. That capacity has been increased and has now reached 10,000. COVID-19 patients were transported by train or planes to less affected regions or countries, from east to west, like Normandy, for example. Beginning of April, we welcome 52 patients from Paris area.
Thank you very much, Marjolaine. A second question. How and what digital technologies have been deployed so far in France to fight and control the epidemic?
As anywhere in the world, I suppose, teleconsultation jumped up. In Normandy, we had 6,000 teleconsultations per year during previous years. We are now at 30,000 per month with various digital solutions, private companies, startups, software companies, or public digital health companies such as Normand E-Santé, which deploys a teleconsultation service called Therapy. Therapy is a full web teleconsultation solution. The doctors connect into Therapy via his web navigator, enters securely into his home page, and either can require an immediate teleconsultation with the patient or can schedule one. The patient has access to teleconsultation by clicking on a link from a text message or a mail automatically generated while scheduling. Patient and doctor can see and talk to each other, send any document. Patient can pay online at the end of teleconsultation, and the doctor can send them a prescription or send it to their pharmacist. For patients staying in nursing homes or other facilities which may have medical connected devices, vital signs can be sent through Therapy and teleconsultation can be done. At NES, we prioritize local care with teleconsultation done by patient usual doctors, protecting standard care pathways, including medical specialists. We wish to preserve local hospital and private practice links, and unlike private companies, Therapy permits to reach this goal because every public or private hospital and a lot of private healthcare professionals are connected via therapy. During this pandemic episode in France, regions managed to buy masks and other materials as regional public digital health companies worked together, providing simple telemedicine solutions. The regional level demonstrated its efficiency. We also worked with digital health companies, which provided medical connected devices, such as connected stethoscope, otoscope, pulse oximeter, ECG monitoring, tensiometer, thermometer, digital tablet and video camera. NES loaned those devices for free of charge to home-based hospitalization, pre-professional medical centers, retirement homes, or firemen. All this in order to allow teleconsultation to take place under good condition for patients who need them the most. We also set up a remote monitoring system for COVID plus or suspicious COVID plus patients with liberal nurses and general practitioners. Patients answer a short medical questionnaire twice a day, and alerts are sent live to nurses or general practitioners if their patient health status is deteriorating. The system is called SCAT COVID MediConsult. We just launched this new activity, and the first challenge was to find an agreement on a healthcare organization that suits both public and private healthcare professionals. Regarding epidemic control, digital health solutions are being built, but they are not implemented yet in France, such as live detection of potential COVID plus patients.
Thank you, Marjolaine. A third question. Have the measures and deployments been effective? If so, how? And if not, why?
Concerning telemedicine, we don't know yet about its efficiency. We only know that teleconsultation allows everybody to access to medical care without moving, and also not to stay in patient's waiting room and potentially be contaminated by others. For medical doctors, they can safely continue to take care of their patients and treat their suspecting COVID plus patients more safely. Feedbacks from patients or healthcare professionals are very positive on therapy. Easy, practical, without any installation and free of charge. Those feedbacks come from our technical support team and from a panel of our major users. Along with the pandemic, chronic patients with very incapacitating disease remain, and telemedicine allows us to pursue an appropriate care in order to avoid deterioration of their health status. However, primary care demands have severely decreased, and doctors fear delays in diagnosis and appropriate care for every disease. Concerning remote monitoring for COVID plus or potential COVID plus patients, it is beginning in Normandy, so we do not have any tests or on benefits yet, but we are hoping they will be important also during critical moments around day 10.
One last question. Any other lessons learned and takeaways you would like to share with us?
In Normandy, NES had built for 10 years a solid infrastructure for telemedicine, initially deployed in hospital and nursing homes and less among liberal doctors. Now that digital highways are here, IT and security staff too. Technical support team available 7 days a week from 8 a.m. to 8 p.m. Healthcare professional, liberal or not, are massively using our solution, therapy. Availability and professionalism of our technical support team seem to be main advantages during this pandemic. While discussing the use of telemedicine with medical doctors, many of them say they will definitely continue to add teleconsultation into their consultation schedule after COVID-19, so one of the many positive, I hope, consequences of the crisis may be a significantly greater use of telemedicine. Thank you all for listening, and I hope to see you in Winter 2.
Marjolaine, thank you very much for these precious contributions and insights. Hoping to see you in person on September 21st at the eHealth Application Summit in Winter Tour.